welcome to Your Family Dog, a podcast dedicated to helping families love living with dogs. Here are your hosts, Julie Fudge Smith and Colleen Pelar.
Hi, welcome to Your Family Dog. I'm Julie Fudge Smith, and I'm here, as always, with the lovely Colleen Pelar. And today we have a special guest returning to talk to us is Dr. Alicia Karas, who is a veterinarian and a member of the faculty at the Cummings School of Veterinary Medicine at Tufts University. She's an anesthesiologist. She's also a pain specialist. And she's becoming very good at helping people make decisions about their elderly pets. Not only the kind of care that they need, which is what we covered last time, but when the decision has to be made to let your pet go. So, Dr. Karas, how did you get involved in this kind of thing?
Because I see a lot of dogs for pain consults, or dogs and cats who are older. And because I get a lot of cases referred to me from our oncology service, so they're dogs and cats with cancer, I had to sort of start to think about the human-animal bond, not just what medications or what modalities I'm going to use to treat this, but how are we going to start to have a conversation about how your dog is doing? And as you guys say, how do you know when it's time? That's really complicated. That is something they did not teach in vet school. And I'm not sure that we do that very well in human medicine either.
No, I wouldn't say so. I don't think we do that well in Western society. We don't. We seem to have lost our sense of the place of death in life, since we all live so much longer and we don't have the high infant mortality rate, or women aren't dying as much in childbirth, and we have licked so many diseases. Death is not as perhaps easy or common a subject for many people, and so therefore something to be avoided. But with our pets, unfortunately, as you said in the last episode, they are aging much more quickly than we are. And if you're going to have a pet, you're going to have to face this. So what can we do to help people understand when the time has come, and how do you make this decision? Do you have any suggestions on that?
I actually should have said this when we talked about evaluating your older dog. I think, we have an amazing tool nowadays in our cell phones. And I actually think one thing that we should probably start doing is having some videos of our dog and photos of our dog, and periodically looking back and reviewing how do they look. Because it's very difficult to, as changes happen gradually in your dog, it's very difficult to sort of figure out that they have occurred. So then you can look back, 3 months ago, 6 months ago, 1 year ago, this is how my dog looked. And wow, he's really quite gone downhill since then.
That just happened in my house this week. I have a son in the Air Force, and he hadn't been home since July of 15, July 15. So a year and, 8 months or something. And he said that my dog's tail carriage looks a little different. And when he said it, I looked and went, oh, I think you're right. And I think it's not tremendously different, but it is different. And Kyle noticed it right away because he's not seeing him every day. And I hadn't seen that because I am. So just gradually changing. So looking back at photos and videos would give you that objective distance to go, that is different.
Yeah, I would agree. I was looking at, I put a dog down in July from cancer, and looked back at pictures of Bing the day that we put him down, and back over the course of several months when I was ready to look at it, I realized actually there was a deterioration. I perhaps hadn't wanted to see it, but it was there. And so sometimes I think that's a great tool. I think it's really hard for us to see. I think that it's also very easy to make, well, it was a bright day, so of course he's, squinting or, whatever. So, but I think that's really true. I think that's a great way to see it. And to have somebody else take a look at it and go, wow, yeah, there has been a change in your dog's behavior. So that is a great tool. I think your comfort diary, which we talked about in the last episode, is another great way where you sort of get some objective feedback as to what's going on with your dog. If you've been maintaining this for several weeks or even a couple of months, you're going to begin to see, wow, if I look at it this week, what's happening with him and his attitude today. The last few weeks, you've had a lot more of uninterested and depressed, whereas a month ago, we had happily greets others. What's going on? So I think that the comfort diary can be an eye-opening thing for people as well. Put that in combination with pictures and videos, and you begin to see the reality of what's going on with your elderly dog.
And yet, we don't want to face it.
No.
It is, that's very interesting because it's going to be a real struggle. People have various different philosophies about life and end of life.
Right.
And I think that they range from, I don't want my dog to suffer at all, and I'm willing to undergo the suffering myself to make the decision to euthanize my dog. And there are other people who say absolutely would not consider killing my dog. Mm. And so my dog just has to die on his own. And that becomes very difficult because we do have some veterinarians who do hospice care and help us with that sort of thing, but we aren't really able to do hospice care the way that we can do that in humans. And so it does concern me when we actually have something that truly, truly will end suffering.
Yeah.
When people are not willing to see it. And on the other hand, we are faced with family members, friends, sometimes our veterinarians, who take a look at our dog and say, oh, he's suffering, why don't you put him down? Mm. And I never would say that to a client, to a pet owner, until I had really been through a conversation about quality of life. Because I have a client right now who has a tiny little old Italian Greyhound who's missing a lot of her external body parts and is really frail and is blind and is deaf. But when I talk to him, she responds to him, and she has a wonderful, good relationship with him. And if we can keep her comfortable, there's no way I would judge him and say you need to make a decision to euthanize this dog.
Right. Well, one of the things I tell people because I think, Colleen, we get a fair number of people asking us, how do you know when to let go? And being a trainer and working with dogs every day doesn't make me any more of an expert than anybody. But the one thing I do try to tell people is exactly what you were saying is look at the quality of life of your dog. Is he still engaged? Is he still eating, drinking? Is he, sleeping okay? Is he going out? Is he still seeking out attention and affection? And those are qualities of life that may mean that he's not quite ready to go. And so you may be looking at palliative care to help him be more comfortable to achieve those things. But I think quality of life is something that you can take a look at it and quantify for a bit. But boy, quality of life, that's another sort of subjective term as well.
It is, especially because they can't tell us,
Right.
But there's so many times that I turn to a dog and I'm like, use your words. Just tell me. Because it's a very difficult thing. And with any sort of hospice care, any of that, we're looking at, can I make you feel safe and comfortable and happy? Whatever we can do. These are sort of our goals. And with a lot of the aging and the treatments and things, we might be extending days, but we're not necessarily extending the safe, comfortable, happy feelings. And right. That's a tough thing. And it's a very hard conversation to have because none of us ever wants to lose our dog. But there's a middle ground. And I think opening a conversation about it, not with your dog is suffering, you should put your dog down, because that doesn't open the conversation. That kind of shuts the conversation down.
Yes,
and we build
absolutely.
up walls. but starting the quality of life conversations and how is your dog and even how is your dog today versus yesterday, like just as a regular conversation with a friend. So how is your dog right now? Because that can at least, when we have to use our words to describe, well, today he's a little uncomfortable or, oh, he's much better than yesterday. We start actually mentally tracking and seeing a little bit of, well, there are some changes going on here and how is he? It's never, ever easy, though. That's the miracle if we could just get like that magic pill that would just be like, here's how you exactly know, and it won't hurt anyone emotionally or physically ever. Yay. That's the holy grail.
But I think the conversation is important to have because I think you've got to help owners start to break through the denial of the reality of their dog. If their dog is really beginning to have some cognitive dysfunction, if he's in some real pain, if we're talking about, constant urinary tract infections or kidney stones or, various other things that are a recurring problem and that are making him uncomfortable and it's harder for him to recover from these things. And then they can exacerbate other things. Maybe he's got diabetes as well or Cushing's, and these are exacerbating circumstances as well that you have to at least open up the conversation, and I think by asking, how is he doing? And how's he doing in relationship? Has he, if this is a good day, how many good days is he having? Is this pretty constant? Because if you don't start the discussion, you certainly don't want to get it to the point where I'm denying, and suddenly somebody's saying you have to do it now. And that's really tragic, I think, for somebody to have to make that decision without any sort of forethought.
It is. Do you know there's also very easy to find quality of life scale, the HHHHHHMM scale, and I can actually send you guys a link, and you probably your viewers would probably be interested in it, which is written by someone who's done a lot of pet hospice, and it talks about the hurt, hunger, hydration, hygiene, happiness, mobility, and more good days than bad. And it's also a nice way to evaluate your dog. I think that we need these guides. We need these guides for ourselves.
Right. I think that would be really terrific. I think that would be something that
great.
Yeah, that anybody who has an elderly dog who has issues would find that to be very useful. So thank you for that. I am kind of curious, Dr. Karas, how do they handle this kind of thing in vet school? I know you learn a lot about diseases and stuff, but do they handle things like how to talk to owners about how to recognize when a dog is ready to go, how to talk to an owner about it? Do they give any kind of instruction in that area?
Well, I never did have that when I was in veterinary school, and the thing is that we are starting to actually have instruction in communication and what we would maybe call the sort of softer sciences, the talking about the human-animal bond. This is really important. We recognize the value of the pet in the human's life. Mm-hmm. And the behaviorist is recognizing the relationships, sometimes when those things go badly. Mm-hmm. And so that's over time, we've been able to allow those conversations to creep in. We still don't have probably enough instruction on that. And then I think what happens is the veterinarian graduates, and in continuing education courses, people will do things like talk about quality of life scales and communication. So sometimes it's post-graduation that you're learning that stuff as a vet.
So when you look at the comfort diary for dogs or the HH, I can't remember how many H's there were. Is that something? There were a lot of H's. That I do remember. Is that something that could be applied? I mean, we talk about dogs, your family dog, but a lot of people have a wide variety of animals. Would this be something that would be applicable to cats or horses or other animals as well? Would those be guides for people that have multiple species households?
Oh, I definitely think so, and probably for humans as well, except that we're not generally allowed to end life in humans in most of the 50 states when we think that it's not, there isn't any quality. I definitely think so. If you have a small dog, you can handle a small dog or a cat who is incontinent or can't get around easier than you can do with a large dog or a horse.
Mm-hmm. True.
So when, if you're, elderly and you can't help your giant breed dog get around, then you might have to make a decision that's based a lot on logistics, because your dog can't just lie there, and urinate on himself.
True. So if you had to name a few things that would really indicate to you that a dog is in the end stages and that you need to be thinking about what's coming next, what would you tell owners?
So the absolute criterion for it is time, in my mind, is when the dog cannot think about anything outside of his own body. Your dog gets to that point, it probably should have happened yesterday. And now I say that, but, probably anybody who's been through childbirth or passed a kidney stone or broken a leg had some period of time where they couldn't really think of anything outside their own body, and that doesn't mean that you're going to die. But I think when the dog is, dogs are amazing. I had a dog who had a gastric torsion, and of course I was at the hospital, and they were going to take him into surgery, and he had lost several units of blood and was feeling really crappy and was pretty much dying. And they asked me to come in and talk to him, thinking maybe that it would be the last time we talked. And I walked in, and darn if he didn't wag his tail. So it's a little bit, that's, kind of the equivalent of somebody who's suffering very badly giving you a smile. And so it doesn't mean that he's okay because he can wag his tail, but dogs are pretty amazing at still trying to respond to us and trying to give us the signals that are part of our bond.
Right.
So, I think that the trick would be, what I try to talk to people about is, if you think that your dog is doing badly and that you're really having the conversation about euthanasia, one thing is to arrange it. That's very difficult for people. Mm-hmm. But you would like to know which family members do you want to have present. How does your veterinarian... How would it be best for your veterinarian to attend to you and your dog without it being uncomfortable or rushed? Mm-hmm. And sometimes that means an after-hour appointment. Sometimes some veterinarians will, for their good clients, will come to the home. There are now, and it's quite a blessing, there are now veterinarians who do house call hospice and euthanasia practice. It's a growing business, and it is tremendously helpful because they are very good at what they do. These are people who've learned how to talk about these things, and they'll come see your dog in your home, which is different than in the vet clinic. And they'll say, oh, look, these are things we're going to do to make him more comfortable. These are things we're going to do to make him function better. These are things you're going to look at. So I think that's helpful.
Are there any organizations where someone could look for this specialty, or you just look through vets to find someone who has a specialty?
No, there are a couple of, there are quite a few actually organizations now. Right now there's, depending on the geographic location, and some of them are actually have veterinarians sort of all over the country. So there's Home to Heaven, and one of my good colleagues and I are doing actually a euthanasia study, a survey for veterinarians right now about that. There's Lap of Love. But if you Google right now, I think if you Google house call veterinary euthanasia, you'll come up with one of those. And there are, not everybody belongs to those organizations, but it's helpful for locating somebody.
Right. Yeah, that'd be great to at least give people a place to start. So when we are planning that event, from the dog's perspective, is there anything that you feel that would be helpful that we did to make it easier for our dog? Like more people or less people? Does that matter? Any of these pieces that...
Well, this is a very tough thing. I'm an anesthesiologist, and I believe in the use of sedatives and calming agents to help animals feel better. So one of the things that I would like to see is that your vet would be willing to consider using sedation by injection, sometimes, orally, things like that. And because you can't conceal your emotions from your dog. Mm-hmm. So, they're upset because you're upset. So I think the sedation helps people. But I also think that that researching it, and there are organizations that have a lot of stuff online about understanding grief and understanding the death process and things like that. And I think doing some research is very helpful because you're less likely to be upset by, oh, my vet wanted to use sedation and I thought that was terrible. You're less likely to be upset than if you actually know something about it. So inform yourself about things, which would be useful.
Okay. Those are very good suggestions. I think when you were saying that, you went in to see your dog and he wagged his tail, it was when I had to let go of my Bingley last July. He was slipping. He wasn't responding to me in that way. I knew at the end we went outside. They had the tubes and everything, and they gave me a little bit of time, and we went outside and sat in the grass together, and he put his head in my hand, but he didn't lean on me in the same way. I mean, I just knew that he was slipping away anyway. And so I said, it's okay. It's okay, dude. I know that this is hard for you. And when he was no longer actively seeking to make that connection to me, I knew that I was making the right decision. As difficult as it was to say goodbye to him, I had to do it for him. So I think that recognizing that slipping of the human bond, of his or your dog's bond to you, is probably a pretty good indication that the time is coming very soon. So, yeah, you said that, and I was right back there.
Yeah, I was too, with the previous dog.
So anyway, Colleen and I are going to start crying now, so you can finish up this podcast for us, Dr. Karas.
Well, let me just say one thing about timing that I tell people. This is euthanasia is a gift. But the other thing I tell people about timing is everybody worries. They want their dog to give them a sign. And the sign does often appear. But you have to be willing to say that there won't be a sign. And you are going to have to make the decision. Everybody worries that they decide to do euthanasia too soon. The person who suffers if you decide too soon is you. The person but the risk of waiting too long means that your dog suffers. It's this selfless thing that we do, and that's why it's so difficult for people. And honestly, there are people to talk to about this. Your vet is a good person to talk to about this. Sometimes your clergy member, things like that. They're really equipped. Vets are not necessarily equipped to handle the human soul, so it's worthwhile talking to somebody who's actually professionally a counselor sometimes.
And I think that phrasing is really valuable because so often when someone we love is struggling, we say, if I could take that on, I would, like if I could take this pain.
Right.
And so when we look at this question of, if we go too early, who does it hurt? It hurts me. And if we go too late, who does it hurt? It hurts you. That at least helps a little bit because given my choice.
Right.
Yeah. And you're absolutely certain, I mean, people have different spiritual values. I happen to feel that, once death happens, your dog can't suffer. So
Right.
it's hard. So at that point, it's just you.
Mm-hmm.
So, that becomes, you take it all on, and your dog's not there to comfort you. So
Right.
it's really, it is really, really difficult. But in the old days, you just, if your dog was urinating in the house, that was it. Off he goes to the vet
Right.
and gets euthanized.
Yeah.
So we can't help having evolved our bond with animals and having to face these difficult situations.
The other thing I wanted to mention is that I know when you said about finding somebody to help you, the Ohio State University Veterinary Hospital has social workers on staff to help people deal with the issues having to deal with their dog. And I always thought that was just a really terrific thing. In fact, when our priest had to take his dog in for some tests for kidney disease, I called the behaviorist there and said, my priest is coming in. Would you mind meeting? She goes, people never think about taking care of priests, that they may need help. So she had the social worker meet him at the door, and he didn't really need it, but he did appreciate the fact that somebody was being solicitous of his feelings for a change.
Yeah. So the average primary care veterinary practice cannot support having a social worker or counselor, right. But I am absolutely blown away that at my age, I have only just found the value of somebody like that. And it's because I'm the mentor for the student-run pet loss hotline that we run at Tufts. And so our students sit and man the phones every evening, and people can call in from anywhere with grief issues, with complicated grief issues. But one of the things that we recognize is that when we're dealing with grief as veterinarians all the time, we need help. Mm-hmm. And so we have a licensed social worker who works with our students to debrief and talk about their feelings. And the fact is, it never would have occurred to me until I started working with her to actually go and see a counselor. And so when we ask people, if you're having trouble, what do you do? And it turns out if you turn over your health insurance card, on the back, it says it has a number to call for mental health issues. Mm-hmm. So I think that kind of support is very useful. This is not about how to take care of your dog. It's about how to take care of you. But that's relevant too, because if we don't do a good job of taking care of ourselves during this time, it means we probably won't have another dog. Right. That pain was so awful, I can't ever do that again, kind of thing. Right. And that doesn't help us or future dogs or any of that. So I think it's all a piece. I am glad we're doing a better job of really recognizing the human-animal bond and seeing that there is a connection and that the grief is real and it's, very difficult and it affects your life in all the little tiny daily ways. So it does. It's nice that we're getting there on some of this stuff, but it's never going to be easy.
Right. Okay. Well, on that cheerful note, but I will say that one of the things we talked about is we did give people a sort of a way to look at it, to take a look at what is your dog's quality of life. And that's something that needs to be assessed realistically and decide, are we have enough quality of life to continue? The idea that if the quality of life is deteriorating and you wait too long, I love the way you said that, Dr. Karas. If I do it too soon, I suffer. If I do it too late, my dog suffers. And that's probably a pretty good guideline for people. And the fact is that when you have to make this decision, if you feel as if you've just gone through an Aztec sacrifice and your living heart has been ripped right out of your chest, that's okay. There are others out there who can help you, be it a clergyman, social worker, other mental health worker, and then don't be afraid to seek help for the genuine and real pain that you are feeling at the loss of your dog. So thank you so much for being with us. Really appreciate all your insights. And too bad Tufts is so far away from Colleen and I. But thank you very much for joining us.
We're really grateful that you came and shared all your thoughts. Yeah, alleviating the pain of our pets and our own pain.
Thank you for all your great work. too.
Well, thank you. All right, Colleen, I'll see you next week.
Okay.
All right. Thank you, Dr. Karas.
Thanks for listening to Your Family Dog. Got questions? Interesting ideas? Colleen and Julie would love to hear them. Call 614-349-1661 or visit www.yourfamilydogpodcast.com to share your thoughts.
Hey, if you enjoyed the show, could you do us a quick favor? Head over to iTunes or Google Play or Stitcher or wherever you get your podcasts and leave us a review. That will help other families find quick and easy tips for enjoying life with their dogs. Thanks!